The impact of diabetes on your body organs.
Diabetes is a chronic condition that affects how your body processes glucose sugar.
When blood sugar levels are consistently high, it can lead to damage in various organs.
Let us explore how diabetes impacts various parts of your body.
Heart and diabetes.
Cardiovascular disease, CVD, and coronary artery disease, CAD.
Platelet dysfunction. Diabetes can lead to platelet dysfunction, affecting blood clotting.
Platelets are essential for wound healing and preventing excessive bleeding.
In people with diabetes, platelets may become stickier, increasing the risk of blood clots.
These clots can block blood vessels, leading to heart attacks or strokes.
Blood vessel and nerve damage.
High blood sugar levels damage blood vessels and nerves that control the heart.
Damaged blood vessels can restrict blood flow, causing chest pain, angina, or heart attacks.
Nerve damage can affect heart rate and rhythm, leading to arrhythmias.
Prevention and management.
Control blood sugar levels.
Regular monitoring and maintaining optimal blood sugar levels are crucial.
Follow your healthcare provider's recommendations for medications, diet, and exercise.
Healthy lifestyle choices.
Adopt a heart-healthy diet, low in saturated fats, trans fats, and added sugars.
Engage in regular physical activity.
Avoid smoking and limit alcohol consumption.
Medications.
Some diabetes medications also protect the heart, e.g. metformin.
Aspirin may be recommended to prevent blood clots.
Regular checkups.
Visit your doctor for routine checkups, including blood pressure and cholesterol monitoring.
Address any risk factors promptly.
2. Kidneys.
The kidneys play a crucial role in filtering waste products from your blood.
Diabetes-related kidney damage is called diabetic nephropathy.
Here's how diabetes affects the kidneys.
Microvascular damage. High blood sugar levels damage the small blood vessels in the kidneys, affecting their function.
Proteinuria. Diabetic nephropathy can lead to protein leakage in urine, proteinuria, which indicates kidney damage.
Kidneys and diabetes.
Diabetic nephropathy.
Microvascular damage.
High blood sugar levels damage the small blood vessels, microvasculature, in the kidneys.
These tiny vessels play a crucial role in filtering waste products from the blood.
When damaged, the kidneys become less efficient at filtering waste, leading to impaired kidney function.
Proteinuria.
Diabetic nephropathy can cause protein leakage in urine, a condition known as proteinuria.
Normally, the kidneys retain proteins in the blood, but damaged vessels allow proteins to escape into the urine.
Detecting proteinuria early is essential because it indicates kidney damage.
Prevention and management.
Blood sugar control.
Maintaining stable blood sugar levels is crucial to prevent kidney damage.
Follow your healthcare provider's recommendations for medications, diet, and lifestyle modifications.
Blood pressure management.
High blood pressure, hypertension, is a common complication of diabetes.
Controlling blood pressure helps protect the kidneys.
Medications, such as ACE inhibitors or angiotensin receptor blockers, may be prescribed.
Regular kidney function tests.
Regularly monitor kidney function through blood tests, e.g., serum creatinine, estimated glomerular filtration rate.
Early detection allows timely intervention.
Healthy lifestyle choices.
Maintain a balanced diet, low in salt and processed foods.
Stay hydrated.
Avoid excessive alcohol consumption.
Eyes.
Diabetes can cause eye complications, including diabetic retinopathy.
Here's how it impacts the eyes.
Retinopathy. High blood sugar damages the blood vessels in the retina, leading to vision problems and even blindness.
Let us explore how diabetes affects the eyes, specifically through a condition called diabetic retinopathy.
Diabetic retinopathy.
Diabetic retinopathy is a serious eye condition caused by damage to the blood vessels in the retina, the light-sensitive tissue at the back of the eye.
Here is how it impacts vision.
Blood vessel damage.
High blood sugar levels cause damage to the tiny blood vessels, capillaries, in the retina.
These damaged vessels can leak fluid or blood into the retina, affecting its function.
Types of diabetic retinopathy.
Non-proliferative diabetic retinopathy, NPDR.
In the initial stages, small blood vessels leak fluid into the retina.
This can lead to swelling, macular edema, and affect central vision.
Macular edema is the swelling of the macula, the central part of the retina, due to fluid leakage from damaged blood vessels.
This swelling can lead to blurred or distorted central vision and is a common cause of vision loss.
Macular edema can be caused by various conditions like diabetic retinopathy, retinal vein occlusion, and uveitis.
Proliferative diabetic retinopathy, PDR.
As the disease progresses, new abnormal blood vessels grow on the retina.
These fragile vessels can rupture, causing bleeding inside the eye.
PDR can lead to severe vision loss.
Symptoms. Initially, there may be no noticeable symptoms.
As diabetic retinopathy advances, you may experience blurred or distorted vision,
Floaters, spots, or cobweb-like shapes in your vision.
dark or empty areas in your visual field.
Sudden vision loss in severe cases.
Prevention and management.
Regular eye exams. Early detection is crucial.
Visit an eye specialist, ophthalmologist, regularly.
Timely treatment can prevent or slow down progression.
Blood sugar control. Maintain stable blood sugar levels to reduce the risk of retinopathy.
Blood pressure and cholesterol management. High blood pressure and cholesterol contribute to retinal damage.
Lifestyle choices. Avoid smoking.
Control other risk factors, obesity, sedentary lifestyle.
Feet and legs.
Diabetic neuropathy affects the nerves in your feet and legs.
Nerve damage, numbness, tingling, and pain in the feet and legs due to nerve damage.
Poor circulation, reduced blood flow to the feet can lead to slow wound healing and foot ulcers.
Feet and legs in diabetes.
Diabetic neuropathy.
Nerve damage. Diabetic neuropathy refers to nerve damage caused by high blood sugar levels over time.
Nerves in the feet and legs are particularly vulnerable.
Symptoms include numbness. You may experience a loss of sensation in your feet and legs.
Tingling and burning. Some people feel tingling or burning sensations.
Pain, neuropathic pain, can be sharp, stabbing, or throbbing.
Loss of reflexes. Reflexes, such as a knee-jerk reflex, may diminish.
Poor circulation. Diabetes affects blood vessels, leading to reduced blood flow, peripheral vascular disease.
Poor circulation affects the feet and legs.
Delayed wound healing. Reduced blood flow impairs wound healing.
Foot ulcers. Slow healing can lead to foot ulcers, which are prone to infection.
Cold feet. Reduced blood flow can cause cold feet and legs.
Prevention and management.
Foot care. Inspect your feet daily for any cuts, blisters, or sores.
Keep your feet clean and moisturized.
Trim toenails carefully to avoid injury.
Footwear. Wear comfortable, well-fitting shoes.
Avoid tight shoes or high heels.
Check inside your shoes for foreign objects before wearing them.
Blood sugar control. Stable blood sugar levels help prevent nerve damage.
Follow your diabetes management plan.
Regular checkups. Visit a podiatrist, foot specialist, regularly.
Address any foot issues promptly.
Brain.
Diabetes affects brain health.
Cognitive decline. Some studies suggest a link between diabetes and cognitive decline, including memory problems.
Let us explore how diabetes can impact brain health, particularly in terms of cognitive function.
Brain and diabetes.
Cognitive decline, memory problems.
Some studies indicate that people with diabetes may experience memory difficulties.
Factors contributing to cognitive decline include
Blood sugar fluctuations. High or unstable blood sugar levels can affect brain function.
vascular changes. Diabetes-related vascular damage can impact blood flow to the brain.
Inflammation. Chronic inflammation associated with diabetes may affect brain cells.
Types of cognitive impairment.
Mild cognitive impairment, MCI.
MCI is a stage between normal age-related cognitive changes and more severe cognitive decline.
People with diabetes may be at higher risk for MCI.
Dementia.
Dementia is a more severe form of cognitive decline.
While diabetes alone does not cause dementia, it may contribute to its development.
Prevention and management.
Blood sugar control.
Stable blood sugar levels are essential for brain health.
Follow your diabetes management plan diligently.
Healthy lifestyle choices, regular physical activity, a balanced diet, and adequate sleep support cognitive function.
Engage in mental exercises, puzzles, reading, learning new skills.
Regular checkups. Visit your healthcare provider for routine assessments.
Address any cognitive changes promptly.
6. Other organs. Diabetes can also impact other organs, such as the mouth, teeth, stomach, intestines, lungs, and sexual organs.
Proper management and control of blood sugar levels are essential to prevent complications.
Remember that early detection, regular checkups, and lifestyle modifications are crucial for managing diabetes and minimizing its impact on your organs.
Managing diabetes effectively involves considering its impact on various organs.
Next, we will explore how diabetes affects these other organs.
We'll try to cover main organs.
Other organs and diabetes.
1. Mouth and teeth in diabetes.
Gum disease, periodontitis.
1. Weakened immune system.
High blood sugar levels can weaken the immune system's ability to fight infections.
The gums, gingiva, are particularly susceptible to infection.
When the immune response is compromised, gum disease becomes more prevalent.
2. Periodontitis.
Periodontitis is an advanced form of gum disease.
It affects the tissues that support the teeth, including the gums, ligaments, and bone.
Symptoms include redness, swelling, bleeding, and gum recession.
3. Impact on oral health.
Gingivitis, early-stage gum disease, is called gingivitis.
Gingivitis causes inflammation of the gums, but does not involve bone loss.
Common signs include bleeding during brushing or flossing.
Periodontitis.
If gingivitis progresses, it can lead to periodontitis.
Periodontitis damages the bone and ligaments supporting the teeth.
Teeth may become loose and eventually fall out.
Prevention and management.
1. Oral hygiene.
Brush your teeth twice a day using fluoride toothpaste.
Floss daily to remove plaque between teeth.
Regular dental checkups are crucial.
2. Blood sugar control.
Stable blood sugar levels reduce the risk of gum disease.
Follow your diabetes management plan.
3. Avoid smoking.
Smoking worsens gum disease.
Quit smoking to protect your oral health.
Remember that maintaining good oral hygiene and managing diabetes effectively contribute to healthy gums and teeth. If you have diabetes, prioritize your oral health.
2. Gastroparesis in diabetes.
What is gastroparesis?
1. Delayed stomach emptying.
Gastroparesis is a condition where the stomach takes longer than usual to empty its contents into the small intestine.
Normally, the stomach contracts to move food along, but in gastroparesis, this process is impaired.
2. Nerve damage.
Diabetes can affect the nerves, autonomic nerves, that control stomach muscles.
When these nerves are damaged, the stomach's ability to contract and propel food is compromised.
Symptoms of gastroparesis.
1. Bloating and fullness.
People with gastroparesis often feel bloated and full after eating, even with small meals.
The delayed stomach emptying leads to a sensation of food sitting in the stomach.
2. Nausea and vomiting.
Nausea is common due to the slow movement of food.
Some individuals may experience vomiting, especially after larger meals.
3. Heartburn and reflux.
Delayed stomach emptying can cause acid reflux heartburn, as stomach acid backs up into the esophagus.
Management strategies.
1. Diet modifications.
Smaller, frequent meals.
Eating smaller portions more frequently helps manage symptoms.
Large meals can worsen gastroparesis.
Soft, easily digestible foods.
Opt for foods that are easier to digest, e.g., soups, purees.
Avoid high-fat or high-fiber foods.
2. Blood sugar control.
Stable blood sugar levels are essential.
Erratic blood sugar can worsen gastroparesis symptoms.
3. Medications.
Prokinetic agents.
These medications help improve stomach motility.
Examples include metoclopramide and domperidone.
Anti-nausea medications.
These can relieve nausea and vomiting.
4. Lifestyle changes.
Avoid lying down immediately after eating.
Stay hydrated.
Remember that managing diabetes effectively and following dietary guidelines can help alleviate gastroparesis symptoms. If you experience any of these symptoms, consult your healthcare provider for proper evaluation and management.
3. Lungs and diabetes. Respiratory infections.
Why are people with diabetes at higher risk?
Weaken immune response.
High blood sugar levels can impair the immune system's ability to fight infections.
The immune cells responsible for defending against pathogens, such as viruses and bacteria, may not function optimally.
As a result, people with diabetes are more susceptible to infections, including respiratory ones.
Specific risks.
Influenza, flu.
People with diabetes are at increased risk of severe flu complications.
Flu can lead to pneumonia, hospitalization, and even death.
Pneumonia.
Pneumonia is an infection of the lungs.
Individuals with diabetes may have weakened lung defenses, making them more vulnerable to pneumonia.
Prevention strategies.
Vaccinations.
Flu shots.
Annual flu vaccinations are crucial for people with diabetes.
Flu shots reduce the risk of flu-related complications.
Pneumococcal vaccination.
The pneumococcal vaccine protects against certain types of pneumonia.
Consult your healthcare provider about the appropriate schedule.
Blood sugar control.
Stable blood sugar levels support overall immune function.
Uncontrolled diabetes can worsen respiratory infections.
Hygiene practices.
Wash hands frequently to prevent the spread of respiratory viruses.
Avoid close contact with sick individuals.
Remember that proactive measures, including vaccinations and good diabetes management, can help reduce the risk of respiratory infections. If you have diabetes, prioritize your respiratory health.
4. Erectile dysfunction, ED, and diabetes.
Understanding ED in diabetes.
Blood vessel and nerve damage.
Diabetes affects blood vessels and nerves throughout the body.
In men, this can lead to damage in the blood vessels and nerves that supply the penis.
Impaired blood flow and nerve function contribute to ED.
Common in men with diabetes.
ED is more prevalent among men with diabetes compared to the general population.
It can occur at any age, but is more common as men get older.
Prevention and management strategies.
Blood sugar control.
Monitor and maintain glucose levels.
Stable blood sugar levels are essential.
High blood sugar can worsen ED.
Healthy eating.
Consume fruits, vegetables, and a high-fiber diet.
Limit sugar intake.
Include foods with a low glycemic index.
Physical activity.
Regular exercise improves blood circulation and overall health.
Focus on yoga, aerobic exercises, and strength training.
Avoid alcohol.
Excessive alcohol consumption can worsen ED.
If you drink, do so in moderation.
Quit smoking.
Smoking damages blood vessels and worsens ED.
Treatment options.
Oral medications.
Drugs like sildenafil Viagra, tadalafil Cialis, and vardenafil Levitra enhance blood flow to the penis.
Consult a healthcare provider for appropriate prescriptions.
Vacuum devices and injections.
Vacuum erection devices create a vacuum around the penis, drawing blood into it.
Injections directly into the penis can also improve blood flow.
Psychological support.
ED can cause anxiety and stress.
Counseling or therapy may help address psychological factors.
Remember that proactive management of diabetes, lifestyle changes, and seeking professional advice can significantly improve sexual health and manage ED.
If you experience ED, consult your doctor for personalized guidance.
Summarizing the key points. Managing diabetes effectively involves a holistic approach, and your focus on blood sugar control, regular checkups, lifestyle choices, and education is essential.
Here is a concise recap.
1. Blood sugar control.
Regularly monitor blood sugar levels.
Follow your healthcare provider's recommendations for medications, diet, and exercise.
2. Regular checkups.
Visit your doctor for comprehensive assessments.
Address any concerns promptly.
3. Lifestyle choices.
Maintain a healthy diet, low in added sugars and processed foods.
Engage in regular physical activity.
Avoid smoking.
4. Education and awareness.
Learn about diabetes and its impact on different organs.
Stay informed and proactive.
Remember that small, consistent efforts can make a significant difference in managing diabetes and maintaining overall health.
Prevention and management.
Blood sugar control.
Consistently monitor and manage blood sugar levels.
Follow your healthcare provider's recommendations.
Regular checkups.
Visit your doctor for comprehensive assessments.
Lifestyle choices.
Maintain a healthy diet, exercise regularly, and avoid smoking.
Education and awareness.
Learn about diabetes and its impact on different organs.
Be proactive in managing your health.
Remember that diabetes management is a holistic approach that involves caring for all aspects of your well-being.
If you have diabetes, prioritize your health and work closely with your healthcare team.
Please consider to subscribe, like, and forward. Hit bell icon too. Thank you.
Shortly, we will meet with our next video. Thank you